So there are certain controllable factors, including those that might be more common in Native communities, that may put infants at a higher risk for SIDS. Keep in mind that these are not direct causes of SIDS, but they may play a contributing role in terms of the triple risk theory that we just mentioned. Let's take a look at each one of these in more detail. So overheating, alcohol use, commercial tobacco use, pregnancy-related factors, sleep position, soft sleeping surfaces, and loose, fluffy bedding in the baby's sleep area, and bed sharing, which we'll probably spend a lot more time on. So overheating increases the baby's chance that he'll sleep too deeply. And I don't know about you, but I remember when I had my first baby, my grandma, who was very strong, she always insisted that you put the undershirt on and you put this on and that layer on. And so then my baby would be, you could tell he was hot because he was sweating. But of course I never went back on what my grandma said, because Tanya probably remembers her. Yeah. She was a very, very strong woman. But it also can happen if the room is too warm where the baby is. So I think a lot of times parents get concerned that, oh, it's cold in here, baby's going to be cold, so let's turn up the heat, or let's put too many blankets on him, because they're, wanting to keep baby safe and keep baby comfortable. But they don't realize that if the room temperature is okay for you, it's okay for baby too. But I know overheating is definitely an issue that I myself had to deal with, and I'm sure other moms with strong grandmas or strong mamas have to deal with too. And so just being able to tell our family members, well, this is what the latest studies have shown, might be able to help them see things a little bit differently. So if your baby's too hot, of course, some of the signs are sweating or damp hair, little flushed red cheeks, or a heat rash, or breathing really fast. Now, alcohol use is certainly something that is of great concern in Native communities. There was actually it was the Aberdeen area study that one of the PIs was Leslie Randall, who's a Nez Perce tribal member. She's been a mentor of mine for many years. But her studies over in the Aberdeen area, which is the Dakotas,
North Dakota, South Dakota, Iowa, Nebraska.
Yeah, Jara knows that. She used to work there too. But they showed that alcohol use really increased the SIDS risk. The slide clearly shows, one binge episode during the first 3 months of pregnancy increased the risk of SIDS 8 times. And any drinking 3 months prior to and during the first 3 months of pregnancy increased the risk 6 times. And also alcohol use during breastfeeding can cause drowsiness, which means deeper sleep, weakness, and then decreased growth for the baby. Another SIDS risk factor is commercial tobacco use during pregnancy and in the baby's living environment. Jara mentioned secondhand smoke, and we definitely know that's a risk factor for SIDS. Tobacco decreases the growth and function of the baby's developing brain, nerves, and organs, so like the critical development period mentioned in the triple risk, as well as the vulnerable infant. And infants who die of SIDS have higher levels of nicotine in their lungs than infants who die from other causes. So the thing I do need to mention is that SIDS risk among babies whose mothers smoked during pregnancy is up to 4 times higher than the risk of babies whose mothers did not smoke. So that seems pretty significant. Other risk factors for SIDS include pregnancy-related factors. So something like not receiving early regular prenatal care is a risk factor for SIDS. Missing prenatal care appointments means the woman and her family misses education and screening for potentially treatable conditions. Research shows that getting early and continuous care protects against SIDS. Also, preterm labor or preterm birth and low birth weight are also risk factors for SIDS. Regular prenatal care allows healthcare providers to detect preterm labor symptoms, low birth weight, or growth restrictions of the baby, all of which increase the risk for SIDS. Again, going back to looking at stats for our state, the preterm birth rate for American Indian Alaska Native babies is higher than any other communities, though it goes back and forth between our community and African American communities. So making sure that mom gets early and continuous prenatal care is really vital.